everyone. So today we'll be talking about the Google Doctor will see you now, dealing with the modern day patient. Well, as we all know, a lot of people now, we all go online to, if we have a headache, we want to search, oh, why do I have a headache? And of course, when you get online, it will tell you all the different reasons why you have a headache, which is really scary. It could tell you, oh, there's a lump behind your ears, there's something. Basically, we're all doctors. Research has shown that 80% of internet users actually, that's what they search for, health. That's what data is telling us. And 63% are actually looking for a particular disease. What do I have? Is it this? Is it that? Some are looking for medical procedures. That's about 47%. Some are looking for exercise and fitness. That's about 36%. And it's also shown that women actually do the research more than men. So women are 63% and men are 52%. So I'll just go straight now to the panel to sort of ask them some questions based on all these trends that we're seeing now and what their views are about this. So I'll start with Dr. Femi Kuti. Medical professionals are increasingly concerned about people Googling symptoms and self-diagnosing instead of going to see their doctors. What do you think the reasons are for this? Why this trend? And how can we mitigate against these kind of things? Thanks.
Thank you very much for the question, Funto. Good morning to everybody. Good morning to everybody.
Good morning.
Yeah, let's get awake. That's a pretty good question, and I think pretty much like everything that is technology oriented has both its good sides and its bad sides. I think the one good thing is the fact that people are a lot more aware about their health, and that can only be a good thing because it means if people are more aware, they're more likely to seek care, they're more likely to access medical professionals or healthcare professionals at a time that's probably earlier along in the symptoms. But of course, on the flip side, just as you've noted, the downside is also that people can begin to self-diagnose, and especially in a country like Nigeria where it's relatively easy to get medications that should be prescription-based, you can easily access those medications to sort of treat yourself as well. I remember when I was practicing, it wasn't strange to see people come over and say, "Doctor, I have brain cancer." I'm like, well, first of all, I'm not an oncologist. Second of all, if you've diagnosed yourself, what are you doing in front of me, right? Just go to the pharmacist. But I think maybe one primary reason for that is the cost of healthcare. So it's really expensive for people to go to the doctor. It's really expensive to get. So I think that fear of, if I go to the doctor, how much are they going to charge me? I could end up getting this massive charge. But, Google is free. The only amount of money I have to pay is the data that I use to access it. So that's probably one major reason why that's happening. But I think it's also a good channel for us to be able to see how we can get people to access healthcare better if we're able to harness it in a good way.
Right. So, thinking about this trend then, what are the things you think we can do to mitigate these kind of things? I mean, it's happening. Everybody is searching. I do it too. Everybody does it, I'm sure.
I think I actually have a different opinion from what most people think. So most people think that how do we mitigate this? How do we sort of stop people from accessing healthcare? But the truth of the matter is that human nature is just very interesting. The one thing that you ask people not to do is the thing that everybody wants to do. So I think rather than trying to mitigate the trends, I think the onus sort of falls on healthcare professionals to go with the trend. So the fact is, if doctors or healthcare professionals are providing good quality health information, I think the major problem is the fact that we can't trust the quality of information that's out there. So people are accessing, bad information. You see it on Instagram, you see it on pretty much every other piece of online media. But I think instead of us trying to say, oh, stop searching for information online, maybe what we should be doing as medical professionals or healthcare professionals should be putting out more of the good quality information and making it clear that this is what people should be accessing. Because at the end of the day, people are still going to access this information, and when they trust that this is where they'll get good quality information, that's where they'll keep going back to.
Thank you. Thank you so much. Dr. Debo Odulano. So many in the NHS remain skeptical about these online consultations. In fact, they said they could reduce face-to-face with GPs by 40%. What's the implication of this kind of data, and what's the effect on doctors?
So already, I know this is a quoted stat from the NHS, like you said, right? So we can't really look at the NHS that has abundance in terms of workforce and are still strained because the workload on this guys is a lot, right? And they're looking for ways to reduce the barriers to access. So using teleconsults or trying to host remote consultations in whatever way you try to do it helps us to achieve two things. A lot of people don't go to purchase healthcare or go for their health visits because it's too far away, or the complexities of leaving home to the place, or is it really important that I go? So when we look at all those things, we start to put people that don't need to be in the clinic at home, which is really the best, one of the goals of healthcare when we're talking about delivering healthcare effectively. We want to be able to deliver healthcare to people where they are without stress. And that's the optimum when it comes to outcomes. But if we bring that back home here, where look at our numbers, say 180 million people and 35,000 doctors to cover those people. We don't have just an overload problem. The overload problem is like maybe 10 times what it is in the UK. And the professionals are also really strained. So trying to figure out ways to make sure that we can declutter our hospitals or use this as a way to add structure, because we know nobody goes to primary health care centers or the lower cadres of care. If you have a slight headache, you are running to a teaching hospital or a top cadre. So if we start to put in these structures, we're able to get care to people wherever they are and filter out those that really need to be in the hospital, those that really need to be in the front of doctors. And it also helps us to start thinking about ways to achieve task shifting. So if we've moved people to a system where they are actually comfortable with sitting in front of a screen to speak to a doctor, it's a lot easier to start to move them towards chatting to bots, move them towards chatting to other cadres of the health professionals that are not exactly doctors. So I can put a nurse practitioner in front of that person on another scenario and get that nurse practitioner to cascade to a doctor if needed. So these ways are things that we need to really embrace. The numbers are very encouraging. In the NHS, the benefit would be glaring, but I think if we can adopt these things in Nigeria, whichever way possible, the impact here will be also really significant. Now, adopting it is where the issue comes in my opinion. Now, we have a lot of people that use smartphones, but how strong is the internet connection? Is this even across locations? You know, do we need to start thinking about, we want to really promote telemedicine, let's create centers that are purely for telemedicine so we can control the internet connection there so that people get good experiences. Now, most of the people that are trying to do these things in Nigeria, what they are reporting is after time we need to convert our video calls into phone calls, right? That spoils the experience for everyone. There are limitations as well, because communication is a big deal when it comes to teleconsultations, right? While I was in practice, I would have patients that would come in and say they have stuff like baja or stuff like warakba, or they just come and describe something, and that's the extreme. But someone that probably is trying to describe an ulcer pain and comes and tells me the pain is in my lower chest. When I'm talking anatomy and things like that, lower chest doesn't really apply, you know. So having to understand the nuances of our scenario and the fact that a lot of people will be probably interacting with Yoruba person now, then Igbo person next, then someone from Bayelsa, and it will keep increasing. There's a need to start looking at ways to reduce those interferences. So having those centers, having some people in the centers that are not as trained as the doctors, that help to close that communication barrier, are things that we probably need to think about and employ in our own scenario.
All right, that makes a lot of sense. I'm following up on what Dr. Femi said about open access. I mean, people having access to all this information online, but we're worried about the quality in terms of ethics, most especially. So, I mean, a lot of people will look at an article and rate it, oh, it's 70% right, oh, it's 60%. So there's really no authority per se, especially when you're searching on Google, except you go to the likes of WebMD. Those are authorities, but then not a lot of people will go to WebMD. So how do you help your patients to deal with this? Because I'm sure they come to you and like, oh, the symptoms of an attack is when your right arm is aching you, your head swells, and it's just a lot of information out there. So how do you help? So it's going to be addressed to both of you, but I would like Dr. Femi to go first.
Yeah, I think it still kind of ties into the thing that I was saying initially about we need to be the ones, when I say we, I mean medical professionals, need to be the ones sort of like at the vanguard of this, right? So if you look at, say, WebMD that you mentioned, it was essentially medical professionals putting out good quality healthcare information that after a while people trusted that they could go for good quality healthcare information. So, I mean, I think everybody's looking for quality. It's the same way with hospitals, right? Like if you're looking for a place to get treated for a particular condition, everybody can think of, say, 5 or 6 hospitals that there's a kind of consensus that, okay, these are quality hospitals. The thing is that nothing like that exists for healthcare information directed at the tropics or directed at Nigerians. So, I mean, how cool would it be if you could actually Google Paja Paja, right? And you would see like an article on, what Paja Paja really is. WebMD is never going to write about that because they don't even know where that term comes from. So I think the onus is really on medical professionals to start writing or producing good quality content. And I believe that with time, people will know that that's where they can get good quality content. Maybe I should just caveat that by saying that it's not really just medical professionals that should be doing that. I think, this is a technology gathering, so a lot of other people involved in technology would also, because, the website needs to be built, the search engine optimization needs to be done. So I think it's like a consensus effort to make that kind of information available.
All right, thank you. Dr. Odulano.
I think I'll just add to that by saying these things are already in motion. So there are quite a lot of people that have taken this whole trying to educate people about healthcare and improving health literacy personal. And I've used the term personal because they really go hard at it. So I would give an example. There's a guy on Twitter, Aproko Doctor. Every day, and the name is just, it's catchy and it's like Aproko. And he's here to tell you medical stuff, and he will force it into your head in simple ways that will probably make you laugh and stuff. There's another guy that does Tales of Dr. Ron. And what he does is it takes a real clinical scenario and he creates a thread out of it, and he makes it really dramatic, with all the memes and things that people actually really interact with this thing. So beyond trying to certify a few sites that we want to recommend to people, I feel like going out to the channels that people also kind of interact with or interface with would really help. And I'm saying going beyond the social media even. There was a while when paper pamphlets in very low income areas was a thing. And these pamphlets were either being created by some church or Catholic mission or things, and they were giving authentic data. Now those things have become watered down, and every John and his cousins are sharing stuff about, staphylococcus and those kind of things. So, and that's where the real battle is. Because for me, the health system has two key things to do: engage the people that consume healthcare and communicate with them. And that communication really is meant to be driven at making sure that every patient should have control of their healthcare, enough understanding to be able to take charge and make the right decisions. And this decision making even boils down to, should I go to the doctor, should I not? Should I have this surgery, should I not? And the role of doctors, or even let me bring it down to a general practitioner, in most cases, is to help that healthcare consumer navigate through the health system. And we kind of are getting to times where we are trying to understand these roles properly. A lot of it has been very blurred, and that's because we didn't have access to enough information. So information was not democratized. You have to go to the doctor, and the doctor will have this paternalistic approach as well, because he has all the information. Now that that is breaking down, like Dr. Femi said, instead of resisting or trying to mitigate, we need to actually go with these social roles that are being created, right? And understand that the technology is not going to directly interact with us, but we need to shape how it will, control our future and how it will shape the future. With us at Doctora, for example, one thing that I've seen that works, and I'm sure this is also a feature with Reliance HMO, is that when you take a platform approach and users have to sign up, you already have their details. Through that channel, you can stuff them with a lot of information. It's also a way to build trust, because if we want to face the honest truth, the main problem we have in Nigerian healthcare is trust. It's not quality of healthcare professionals. It's not quality of facilities. I know we have some really, really, really bad facilities, but it's not really that. It's just we don't trust these guys. We would rather go to India to do surgery because we think the Nigerian surgeon will forget something inside you. And that is not the truth. They are simple, and again, this is where the tech comes in. Because we seem to think about tech and in healthcare, and we limit ourselves to telemedicine. There are WHO checklists. There are processes that have been solidified, and we know that these things help mitigate risks. Why don't we digitize a lot of these things? Why don't we create patient access to these things as well, so that the accountability levels increase? The fact that practitioners know that patients are keeping track of these things. Patients know that, hey, you're meant to tag me this way for surgery. I've not seen this tag. Please don't remove this other leg. Why have you not marked this? Anesthesiologist has not been here. All those kind of things are things that patients can know. If they can, we should feed them with that information, and health professionals would have less work to do, in all honesty.
All right, thank you so much.